So this is the agenda, going to talk about our responsibilities as OMSAS, considerations, focus on the future, and discuss your experience or what you'd like to be. My points will not take long because the goal here is really to listen to you all, but with just a little bit of level setting about what we don't have control over, because sometimes folks that think that OMSAS has more control over things than we do. Because there are federal rules that we have no ability to waive. So if you could, Treasurer, go to the next slide. So these are our goals as OMSAS, our responsibilities. We want to promote access. So we are supporting choice and access for peers and families to the services that best meet their needs and are delivered in the manner that they prefer, whether that's in-person, audio-visual telehealth, or audio-only telehealth, right? We want to ensure that we license a variety of services to make sure that health and safety standards are being met for peers and families. And we are responsible under preventing fraud to ensure that appropriate verifications are secured so that the billing to the medical assistance program is adequate and appropriate. Next slide. Oh, nope, you had it. There you go. What do we mean by telebehavioral health? So there's telebehavioral health requires real-time two-way communication in which both parties can see and hear one another. Audio only is a separate type of virtual service where it's audio only, requires real-time two-way communication in which both parties can hear each other, but neither party can see each other. And so unless it is specifically referenced in a definition of telebehavioral health, audio only is considered a different type of telehealth than when you can see and hear the person in sort of a virtual manner, as we're doing right now, if your camera's on. So there are some federal and state restrictions that limit what actions OMSAS can take. Federal payment regulations, such as those for outpatient psychiatric clinics, are pretty strict. Those are on the federal level. We can't change them. There are state regulations that, while they could be changed, can be pretty complicated to change. And then we have our state plan. And within the state plan, there are different types of services. And depending on the service type, it can be more strict. And of course, there's federal HIPAA rules around privacy and ensuring confidentiality. So these parameters may, and depending on the service type, like psychiatric outpatient clinic versus peer support. So those are very different in how they are in the state plan in terms of we have a lot more potential flexibility with peer support. We have very little flexibility with psychiatric outpatient clinics based on federal payment regs, based on where they are within our state plan. And so what kinds of services can be delivered via telehealth, how those services are paid for, and administrative requirements related to delivering the services do have some differences across service modalities that we do not control. Next slide. So our goal here is to discuss what the ideal telebehavioral health experience looks like for individuals receiving services and move closer to defining a quality behavioral health service array. So next slide. And so questions, if behavioral health services, do you feel like they're, different service types from mobile crisis to peer support to psych rehab? We're trying to figure out what services that folks have opinions about and whether they should be delivered via telehealth or in person. And also when it comes to choice, are people, either you or the people you advocate for, being given choice about whether they see a provider in person or if they have to, if they're not given a choice and they're told they need to see someone via telehealth. So do folks have thoughts, comments? I'm gonna stop talking now. Really, we are trying to determine, like, should it be based on acuity level? Like if you are 302'd, should the services you receive have to be in person because you don't have a choice to be there? Versus something like peer support or talk therapy? Should should there be that not have limitations on it? So really, I think the question is, what are do folks have thoughts about telehealth and access to services via telehealth? So whoever, if you want to hit the little raise button, somebody needs to talk. Yes, Jackie, woohoo.
Hi, Jenna. How are you?
Good.
Good. So with telehealth, I think that, obviously preferable method should be in person, I think, but I think telehealth should be offered to anyone on an individualized type basis. You know what I mean? I think there's so many individual nuances that providers might experience where telehealth could be beneficial. So I
So
think go ahead.
no, I was going to say, so the question, Jackie, is like, so does that change in your mind on the type of service? And when you say in person is preferred,
Yeah.
do you have thoughts about how to create that flexibility while ensuring, since everybody seems to like to work from home now, ensuring that in-person services are still available? Do you have thoughts on that?
I think you said it. I think that providers should have, like for example, like a residential treatment facility, right? Obviously, in person, the kids reside there, so obviously in person would be more beneficial for youth there. But like in certain situations where a youth might, or a therapist might not be able to be in person for whatever reason, sickness or whatever, telehealth could be provided in that manner. And I'm also thinking like group therapy situations as well. I think that group therapy, and I think federal regs might prohibit this, but I think obviously while in person is more beneficial, I think group therapy should be have an option of being held telebehavioral health as well. Well, all the different regulations and procedural um, options, or not options, but procedural things are being met as well. Like somebody there with the youth in case something happens, parent, guardian, staff. I don't know if that really answered your question or not.
Yeah, it does. And I think the group one is an interesting thing, because if you're in a group of just whoever lives near you, that might not be as meaningful if you're in a group of people in a similar situation, age, gender, life experience as you. So I can understand that, like the group telehealth
Mm-hmm.
concept. Yeah. Who, who else has thoughts, about our goal is to ensure choice for individuals seeking services and flexibility. So Jackie, you raised your hand and you're done, right? I'm looking at or do you have something
Yes,
else to
yes, I
say?
am. Nope, I'm
Okay.
done.
And then Beck?
Hello.
Hi.
I work for the PA Peer Support Coalition, but I'm just here as like someone who receives telehealth, I guess.
Great.
Yeah. Um, so I receive it for trauma therapy, and definitely would benefit from a preference for in-person being stated, because I think that my therapist would rather work from home. And I would also a lot of times choose the convenience of it, but I also think that like I could benefit from having more sessions in person if that was like a preference or some kind of like ratio. That would make sense to me. Also, I couldn't do it from home before because of not like being sure that my HIPAA would be violated, but having that possibility and that living with family, like you don't know who's listening type of situation. So I feel
Yeah.
like if that's the case, you should definitely have access to in person.
So you think it's good to have telehealth access, but also in person, and it should be the individual, the peer's choice, which they want to have?
Yeah, yeah, I would agree with that. I'm not a huge fan of like involuntary stuff to begin with as a peer. I have been through involuntary treatment, not a huge fan. If ideal, we would all be in treatment by our choice. So I don't like to really comment on that side of things.
Absolutely. Tracy, thank you.
Hi, Jenna. I think I'll just kind of tag team what Beck said was I really do believe that, our members need to have choices about how they're receiving services. And I do have concern even with telehealth in some regards around the use of the technology that people have. And I think sometimes it can all be very challenging to, if all you have for your technology is your smartphone, and, again, you may be living in a situation where, like Beck said, you're maybe other people around, just trying to really make sure that when telehealth is done, it's done very professionally. And that's for the provider and for the members. Are you really creating a safe space? Is it, when people are working from home, who's really listening on the other side? And I think those are concerns for a lot of our members, just to make sure that, if telehealth is what they choose. And certainly if you're a mom or you have kids or you don't have transportation, telehealth is an answer. It can really be convenient. It can help. So I think people can get what they need, but, just making sure that the telehealth that is out there is, really quality services. That's what I would hope. And then, we do have a psychiatric shortage of doctors. And, for a lot of people, telehealth is how they're getting their services right now. And so, I'm grateful. I'm grateful that we have that. But I also, again, just want to make sure it's really meeting the people's needs.
Um, great. Treasure, can you move to the next slide? Because we have some more questions. So what about this, right? I mean, we hear, like when Beck was talking about the desire to have the choice. Oh, Tracy, is that you? Did you just re-raise your hand? Okay. I just don't want to make sure I'm not calling on you if you're but what obligation should a provider have if you have a desire to be seen in person because it's a personal decision, a change in your need, or no longer being able to access technology? Do you feel your privacy was respected when you received services? Do you feel informed on your options to receive services in person or via telehealth? I was talking to someone who was telling me that they had a family member who was in his early 20s, and he was fine with telehealth, but he was told he could only have audio only, and he was not comfortable. It's like, I'm not comfortable telling my life story to someone I can't even see, and the provider said, well, that's all that we have available. And so and that was here in Pennsylvania. So I'm curious about your thoughts about, um, patient's choice, and I mean, peers' choices, their rights and protections, and also about acuity of services. Like I know I absolutely hear the desire that everybody is engaged in services that they are choosing to be engaged in, but I'm also wondering about ideas about different service, like peer support. I've heard from several people that peer support via telehealth, including some percentage of audio only, they feel is, because it's the certified peer specialist and the peer receiving the services making those determinations, that's positive. But if somebody is in a higher intensity, an ACT team or partial hospitalization program, that it is more beneficial that the services are provided in person based on the acuity of where someone's at in that moment. Do you agree with that? Do you disagree with that? What thoughts do you have on, like, should telehealth be different depending on the service modality that we're talking about? For instance, mobile crisis. Everybody knows I am very focused on building out the crisis system. Police cannot do a telehealth visit. So when you have a mobile crisis team and the goal is to prevent law enforcement from responding, but a mobile team responds instead, I don't think that it makes sense to have a telehealth mobile team, because in my mind that equals law enforcement. But Chris, what are you thinking?
Okay, I had to unmute. I mean, I can from personal experience with my mother. She saw the
Chris, you
psychiatrist.
somehow, our volume just dropped. You were very loud and then it just dropped down on us.
Okay. Is that any better?
No, but I think Nikki's coming to check what happened.
She's next door. She's coming.
Yep.
I thought maybe you covered your microphone up, but maybe not. Can you guys hear me okay or no?
Yep. Now we hear you great. Perfect.
What was it?
I don't, you might have had something down around here that might have had your microphone covered. I don't know where the microphone is on these things.
Okay.
Yeah.
Okay.
Thank
Yep.
you.
No, you're perfect. You're back to normal.
Okay.
Okay.
Well, I guess that's good. I started to talk about my mother has major clinical depression and psychosis with psychosis uh lifetime, and she was seeing a psychiatrist and a therapist at the time of the pandemic, and we switched to telehealth. At the same time, my mother went into a major episode, major decline. We were doing med changes and pretty regular trying. My goal was to keep her out of the hospital, and and the and we were doing it all telehealth wise, and finally I just said I would like somebody besides me laying eyes on her, and
Yeah.
so the doctor agreed to come in, and I took her down to the Benedum Center, and the doctor said, like, she's the only patient I've seen like in 6 months in person. Everything was telehealth. um and I mean, like, I was like grateful for that. I mean, they were I was getting asked a lot of questions. They knew who I was, they knew my experience, they knew my background. I but I still is it was my mother. I'm not clinical.
Yeah.
And I felt the need for her to be seen. Um and I mean, and she was, but that was an exception, and that was like special. And I think that depending on what service it is, that, like, not just the option to have be seen in person sometimes, but like have the option of when you're not doing well, or like with my mother, somebody needing to see her in person is way different than on a screen.
Yeah.
uh,
I agree.
and I do have a question though. And this is probably maybe just my ignorance in terms of right now how it is, if the evaluation, the initial intake evaluation has to be done in person, it can be done on telehealth. Okay.
Well, it depends on the service, but yes, I mean, and that's the thing, during the public health emergency, um, there was pretty much like open, everything could be telehealth, right? I mean, and now that public health emergency is gone, HIPAA is back being enforced, so you can't just like, you have to follow HIPAA. We are the outpatient psychiatric clinic federal rules were never waived. But that only requires either the provider or the service recipient to be at the clinic, not both.
Okay.
And so, where we are now is trying to figure out um, what, how do we make sure that the person utilizing the service and their family are the people who are making the decision about whether it's telehealth or in person. And that's the challenge because, the providers talk a lot about a significant staff shortage, and it is easier for them to recruit, and it is easier for them to, if it's a 50-minute appointment and they have zero no-shows, I mean, not zero, but the no-show rate is much lower with telehealth. And so from an operational perspective, that is easier, right? But then the question becomes, we're not focused on what's easier, we're focused on what's better quality of care. And we don't want to define that. We want to hear from folks utilizing the service what is, and I think we all would agree. And you guys, those of you who know me, know that I have a 21-year-old child on the autism spectrum who's transgender, who has OCD, major depressive disorder, and for many years struggled with suicidality. But and they see a specialized provider who specializes in autism and transgender, and that is telehealth, because that's not their, it's a rural area and that we're in, they're in, she's in, and so that's who really can understand and be impactful with the layers of uniqueness that are my child. And so that's why we want to support people finding the people that they want as their provider, but we don't want providers to say this is your only option, right? So that's what we're trying to figure out. But we're not, but if families say, well, we want all peers we want all telehealth, and we need to respect that too. So that's what we're trying to listen to and hear.
Yeah, I mean, off the top of my head, I mean, I feel like the individual should have a choice, but I don't like the idea that it's one or the other, like that it has to be just in person or just telehealth. Like, I like what the other lady said about having an option to have it in person, but
But
I
how
mean,
yeah, no, I
yeah,
agree. And how do you regulate that? Any thoughts? I'd love those.
no, just, I mean, like, if you have to do a review, I mean, I don't think you can offer choice too many times to your clients. I mean, I think that has to be at the forefront of service provision, you know, so, and I think you have to be able, to accommodate that, to meet what they want. I know there's shortages, but still, um, and and then the other thing we're not talking about, we haven't yet anyway, is children and teenagers. Because I had a whole mixed bag of experience with that during the pandemic. Kids were forced into telehealth, and some of them loved it, and other kids like just hated it. Like it put them out of therapy, like
Yeah.
because they wouldn't do it. And then you have the behavioral kids that couldn't sit still in front of a screen for anything. I mean, like it didn't seem right that that was the solution to these, to a lot of the special ed kids, that they had to do telehealth. It was of no value whatsoever. Um, Seemed like some other arrangement should have been made there. I don't have any answers, but that's what you're for, Jenna. That's what that's what
Okay.
OSS is for.
So let's go to number 2.
I think that would be me.
That
I
is
just want
you.
to say that we had a kind of a similar situation with a close friend of mine she's 14, and was given therapy but said she had to do her therapy via telehealth. That's who they had available to her. And again, she never really made the connection with the therapist. It was, she went to the meetings and then went into crisis, and it really turned into her being hospitalized, and then because she's in a rural setting, hospitalized far away from home, and mom didn't have any way to get there. And I just, I feel like I'm a pretty good advocate, but in this situation, I just feel like I didn't do her any favors. And, was not much I could do except to support mom here in this community until we got her back home. But again, I don't feel like she ever really made the connection with the therapist to begin with. And it was, all done via telehealth. And so I really like the idea that I don't know if it's like every fourth visit, or not that we'd have to mandate it, but at least that it would be, really offered if somebody is, doing telehealth, but there'd be somebody that would also get eyeballs, especially with children and with young adults and youth, that, somebody could get some eyeballs on them to see how they really are doing. I know they can say anything they want on a screen, but, you can see, if somebody's, cutting or doing things into their, to their body, you just want that to be, I don't know, just somebody to have some eyeballs on them. Just a thought.
Yeah, I wrote that one down. Okay, Treasure, you were gonna just
Yes, I'm offering up a comment from the chat. We have an individual, a participant had stated that offering audio only services while refusing to provide audio visual services for telehealth may be considered a violation of ADA law for clients with limited hearing or without hearing.
okay,
And
thank you.
that is in the chat.
Yeah.
Thanks.
Okay. Yeah. And then so that makes number 2 your number 1 now.
Hi, so I work as a peer specialist.
Yeah.
One challenge that I feel like I've seen more and more is the kind of like the illusion of choice between telehealth and face-to-face, where
Mhm.
it'll be like, oh, I have office hours 2 days a week, and the rest is telehealth. And you can get a telehealth appointment this week or an office appointment 2 months from now. And that's not real choice.
Yep. No, I agree. And so thoughts on that? I mean, I think that's, that's the real question here is how do we put in a bulletin from OMSAS parameters that actually ensure choice so that we don't take away choice for folks who want to do telehealth, but we don't force folks into telehealth services because it's easier for providers. That's the challenge of how, as a statewide regulatory entity, we it's not like, people will tell us, of course we give choice. And then I'll hear from someone who went there and said something like what you just said, like, oh, well, I tried to go to that provider. And if I want an in-person appointment, I have to wait 3 months. If I want a telehealth, I can have it in a month. So, okay. Now we're number one.
Oh, I think that's me. Is it me?
That's you. Yep, it's you.
Okay. So I was just gonna say, I think like back to like the idea of a ratio, or at least the offering of a ratio to us as the people receiving services. I think that would open up a conversation that doesn't happen right now, where if you're seeing your therapist virtually and you have since kind of the pandemic was winding down, there's an expectation that you'll continue to mostly do what you've been doing, which I don't think is always, sorry, I have a bird clock. I don't think is always the ideal scenario for us. Like, even if we're receiving telehealth most of the time and that's what's convenient, it still might not be what's best for us, even if it's our preference too. So I just want to throw that out there and like also say, I wonder if it's something where the consumer family satisfaction teams could take a look at this question and ask people kind of how this is going. Like, do they actually feel like their choice is being honored, or are they kind of not being listened to? And then what are the consequences for that provider? Because I think that's where a lot of times without the accountability, it's not gonna like change how much choice there is.
Well, and this is what this conversation, though, is kind of about, because providers can do whatever the regulations and our bulletins allow them to do. And so they're not breaking any rules right now because we said that we want, individuals to have choices, but we haven't had a ton of specificity under, like the peer support bulletin has specificity, but across services. So that's what we're trying to figure out when we say in the new telehealth bulletin, what, is it all services have the same, or, like I said before, like some services have greater access, or in a month 75% of services, I'm just making stuff up now, so none of this is like 75% of services for an individual can be telehealth, or but that would mean 25% have to be. But then if the person doesn't want to go, we don't want to force them to go. So it's like, but then your point about kids being seen in person sometimes. So it really is like we're trying to figure out and as you could imagine, it's not easy to figure out the parameters for a large rural state with significant urban pockets with very diverse population, to make sure, because what we'd like the rule to be is whatever works best for the client's treatment plan is what should happen. But we can say that in regulation, but unless we figure out a way to actually measure it, every provider will say, well, we offered and they all wanted X, whatever it is, you know what I mean? And so that's where we're trying to really figure out what do people want and how would we regulate that.
Is there some, I'm sorry to just cut in, but is
That's
there
okay.
some way to have both the provider and the person in services asked what ratio of in-person to virtual would you generally prefer, and see if those numbers match? Do you know what I mean? So that there's the choice is being honored, but also the treatment plan. so that everybody's heard. Like, that's the only thing I could think of that kind of.
Yeah, I hear you. I don't know how that would be, or how our licensing staff could measure that. So I guess I would say what's really be helpful. Treasurer, can you go to the last slide? I mean, a bunch of you already have my email, but there's on the last slide of this, there is an email account that I would encourage you to share with anybody you think might have an opinion about access to telehealth from the peer family perspective. And ask them to just send in any, and as you all get, as we've talked about, we all want people to have the type of service that works for them in the way that works for them. And we want it to be determined by what is going to be most therapeutically effective for an individual. But that is very challenging to put in a telehealth bulletin with measurable parameters, and so if you think about, if you have, if you go walking home, walking around, and all of a sudden you're like, oh, I have a way to measure, please send it to us, because we really do want to make sure that we are providing as much access to services as possible. But we don't want to just say, okay, well, everything will be 100% telehealth, knowing that for lots of folks, that may not be a way that is actually very therapeutically beneficial for them, depending on whether that they're comfortable with that, with a telehealth delivery at that point in their journey. And that's the other thing. It could be there are times where it works and it does, other times when it doesn't work. So we want to hear from folks. Like I said, we talked earlier to county mental health providers, to providers, to county mental health administrators, to the BIMCOs. And, I think every group is sort of, some groups, there's the same themes, like, well, telehealth is lovely, but people should have the right to see it in service. But how we quantify that into a bulletin where you shall and you may and those things, to ensure that it actually happens across the Commonwealth. And it's not some of those cases, I have a mental health administrator I talk to often who is very frustrated because her mobile crisis provider only wants to do telehealth mobile crisis. And she's like, that's not a thing. It's mobile crisis. You mobile. And also, one of the concerns is if we're going to 302 someone, somebody should first see them before they determine that is necessary and that the person won't engage in services voluntarily. And that's an important step if because so many folks will choose voluntary services when after having a conversation. So anyway, if you're hit with some brilliance, we will take it. We'll take all your brilliance. So
Jenna, just real quick, I just have one question. Is there any kind of almost like a performance standard around telehealth? Like, I know you're saying we want to do a bulletin, but I'm just wondering if it wouldn't be almost like a best practice and telehealth guide or something like that for providers, or?
no, I think there's research that's emerging around, what telehealth really does is increase access. So
Right.
if you have transportation issues, work issues, that having telehealth increases access for people, they are more likely to not cancel, to be able to receive services that way. I think the challenge is, so that's really positive, increasing access. But because I think it's sort of like making a cookbook of the best recipes, your best recipes and my best recipes, it's
Right.
all individual specific. I think that's so that's where we're trying to say, if someone's in a partial hospitalization program, should their providers have to be in person? If someone's receiving ACT services, should those be in person? Is peer support, how much flexibility should there be for peer support, knowing its nature? That's where we talk about, should it be by license type and not just a standard across all services? And that's where, once again, truly, if you have coworkers, friends who might have thoughts or opinions, please give them this email address and ask them to say, what do they think? Yeah, Beck, what were you going to add to that?
Yeah, I just wanted to ask, as someone who kind of can send stuff to like 3,000 people on our contact list, is it okay if we get some of those questions from the
Oh, yeah.
slide to send
Yeah.
out? That would be
Yeah.
so helpful. I could send an email blast out.
Absolutely. Yep, the slides are, hold on one second. I don't think I can. I'm going to try something here, but
Maybe copy and paste the slide into the chat.
that's what I'm going to see. I don't know if I can post. Have you ever, I've never added a PowerPoint. No,
I'm not a Teams person. Sorry.
no, that's okay. I was trying to add it to the,
Becky, if she goes back to the slide, are you able to take a screenshot of it?
oh no, we'll
That
send it
would be
out.
correct.
Okay.
I could do
Okay.
that. But
Treasure can send it to you right now. Treasure will send it
Okay.
to you. I
thank you so
have
much.
my machine already obviously knows Chris and Nikki. So we're happy to have these slides shared. Just trying to, once again, this is, earlier they're like, oh, so you're going to tell us the new telehealth rules. And I'm like, no, 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 we need to just talk about this because it's not so easy that it's like, you shall do this, this, and this. Yes, Trish.
Hi, Trish She, Her, Hers from Montgomery County. First, thank you for wanting to talk to us. Second, Becky, could you forward me the slides from Treasure? But I wanted to know, what is your turnaround time in hoping to have this bulletin out and trying to get this feedback?
Well, we definitely are looking for feedback as soon as folks are able to provide it. We are, we've been reading a ton of stuff about best practice, but we really are trying to hear from people. So ideally, if folks have opinions, it'd be great if I could get them in the, by like not this Friday, next Friday. I don't even know what that is, like the 9th or something, because I would hate someone to spend a bunch of time thinking about it and then hold on to it for a while. So, but yeah, it really is wanting to ensure access, wanting to ensure choice, wanting to, figure out how we balance that. In any type of regulatory guidance. Because once again, like you said earlier, Beck, like if it's a conversation between a provider, I'd prefer this, and the provider's like, okay, doesn't matter to me. I work out of my office. You can come here or not. Versus, nope, I'm only available to do audio only. Well, that doesn't work for me. Well, that's all I've got. If you want a therapist, that's all you get, so that's the challenge of, that we're trying to prevent those kind of responses for people. Yeah, Chris.
Yeah, Jenna, we have the CFST team for Allegheny County in Indiana, Armstrong. And during the pandemic, and once telehealth like sort of took off, they added questions to their interviews. We have some data from consumers and families on on telehealth and receiving telehealth services. If I could send it to you.
Yeah, we'll take anything anybody has that can inform this. I mean, we really are trying to do an inclusive process of listening to everybody and trying to, these just figuring this stuff out isn't easy, and we can't do it well in a vacuum. And so whatever you've got, whatever thoughts you have, folks, might have thoughts, give them that email, show them the presentation, they can send us their thoughts and data you might have collected, Chris. Yeah, I mean, we don't have like, we're going to do this, but we're going to ask people what we think. As you can tell, it's not easy to say, we want to say the person receiving the service gets to determine what works for them, but is that always the case in all service modalities, or should some just automatically have to be in person? So whatever feedback you are able to provide, we would greatly welcome.
The only thing else that I'm sitting here thinking is when I was a provider, I was a provider of case management services and in intensive billable blended case management now. And we had to document that choice. We had to document the fact that we gave the individual a choice in terms of, did they want us to be their provider, or did they want a different agency, a different provider than us for the case management services. It was sort of drilled into our heads in terms of choice. And I don't know if that would make a difference to have that be required or not. I don't know.
Yeah, and the challenge is that, is the choice really there? Are their staff all working from home? And so, you know,
And
Mhm.
yeah, I don't know.
just one other comment. I have a number of friends who their lived experience is that of having psychosis, and they don't watch TV. Listen to a radio maybe, but they don't use screen time. Screen time just can be really triggering. And so, I think there's certain individuals that telehealth is just not going to work for them.
Yeah.
And, it should be something that they have the option then to be seen in person.
Okay, well, I really appreciate you all spending some time with us. And once again, please do share your thoughts if you and invite others to send us emails at this email address, trying to figure out how we issue a bulletin that really is reflective of making sure that folks get the services they need in the manner that will be most effective for them. Okay. Well, I hope you all have a lovely rest of your Monday. And once again, thank you for spending some time with us.
Thank you.
Thank you.
Appreciate it.
Thank you.